In order to achieve the correct positioning on the assistance stool, you must have a seat and adjust the height so your knees are slightly lower than your hips. When you position the bracing arm directly in front of you and lean forward, this can lead to poor posture. Ideally, the bracing arm should be located at your side to provide you with some support as you lean forward to pass instruments to the operator. The support arm can be swung out of the way to provide you with more space to move and to exit the assistance stool. To raise or lower the height of the support arm, locate the set screw on the side of the chair, loosen it, raise and lower the arm as needed, and tighten the screw back. Your operator's unit works very similar to that in the sim lab. There's an on-off toggle switch and an air and a water control. In addition, you will have a flush control located on the back of the unit. This will allow you to flush out your high-speed and low-speed water lines before use. Students are supposed to flush the water lines before and after use for the recommended amount of time. The chair's control panel will give you access to the overhead light as well as the patient's positioning. You will also notice if there are any errors present on the LED screen. When you first power on your unit, you'll hear a hissing sound of the air, but you might also notice the ADEC logo flashing. If this happens, it means you have a jam in the safety plate. To clear this, raise the chair and the safety plate will be disengaged. You might also notice the word turbine being displayed. This means that one of the handpieces is not engaged in the hanger. Re-engage it and the error should clear. If the power to the chair does not turn on by the switch located on the operator's cart, the master switch might be turned off. This is located on the lower right-hand side of the chair. Make sure that this is in the on position. To change the height of the delivery cart, press the button and raise or lower the unit. There are two foot pedals on this unit. One is to operate the high or slow speed handpiece as well as turning the water on and off. The other will change your patient's chair positioning. From time to time, you will have to change the water supply for your chair. In order to refill the water bottle, you must lift up on the water bottle, twist, and then pull down. Take note of the channels in the top of the water bottle. Align these with the chair unit, twist, and push into place. In addition to the light toggle switch on the control panel, there is also a blue control switch on the back of the light. This can be used to toggle the light on and off and through the different powers. The patient's headrest should be adjusted to provide maximum comfort for your patient. It can be raised or lowered and tilted. As the chair reclines, you'll notice the headrest will slide to ensure the patient's head is fully supported. The patient's chair armrest has three positions. It should be in the entry position, pointing downwards when the patient enters the chair. When they've comfortably seated, you can lift up on the armrest. If you find the armrest is interfering with your work, you can rotate it completely out of the way. Reduced suction can be due to debris caught in the suction trap. You can check this by first turning the suction on and then removing the silver top to see if there's anything caught in the trap. Depending on where you're working in the clinic, such as the ER clinic or grad perio, you might notice slight variations in the touch controls of the chair. The chair controls and icons generally remain the same, but you will have to familiarize yourself with each chair when you reach that particular clinic. For example, this light switch is slightly different than that of the main clinic. On the assistance station, you'll notice a power supply and a quick disconnect for the Cavitron. There is a specialized unit called the 12 o'clock unit. The controls for this delivery unit are located in a slightly different location. There is also a quick disconnect for a Cavitron unit.